Hi everybody out there on Facebook. We are at BioRestoration. We're in Draper and we're about to see a vampire facial performed live. Now I've had this done before, so I know exactly what's going to happen, but if you're thinking, wait a second, I've never seen one of these before, what is it? Kim Kardashian did it? Is it just like that? Which I think Dr. Killen, you would say no, it's not just like what Kim Kardashian had done. So I'm going to switch the camera around so you can all watch what's happening. Who's on the table? Who do we have? Hi, Becky.
Hi.
Becky, thank you for being on our Facebook Live with no makeup on, laying on a table. She's all numbed up. Dr. Killen, I'm going to turn this around so you can kind of talk and everyone through what happens next. Go ahead.
All right, so I'm going to be putting the PRP onto her, which is her own blood, which we then isolated some platelets from her blood to make this very strong growth factor serum. So I'm just going to be putting it on her, and then I'm going to be doing the microneedling, which is this little device that has little tiny needles in it that are going to go kind of up and down really fast.
So Dr. Killen, why put your platelet-rich plasma back on your skin?
Because the growth factors in the platelets will trigger your skin to kind of trick it to regenerate and to make more youthful skin. So you're making more collagen and elastin, hyaluronic acid, the things that make your skin more youthful. This is kind of telling your stem cells in your skin, hey, let's get back to work and make some fresher skin. So that's where you get the anti-aging effects.
So you notice the results over the next several weeks?
Usually starting about 2 weeks is when the fibroblasts start making the collagen. But you'll start to see visible results probably about a month to 6 weeks, and then that continues for out to 6 or 12 months depending on the person.
Okay, you go ahead.
All right. Going. You ready, my dear? Mm-hmm. Okay. This is just a little bit of your plasma on here.
You'll see your colors.
And you're rubbing it in as you put it on?
Yeah, I'm kind of rubbing. I'm using it as a lubricant, and I'll be rubbing it in as we go. The microneedling device is going to make all these little tiny channels in her skin.
Okay, I felt like it'd be red. Am I alone in thinking like it would be red when you put it on her?
Well, it's red there's a little bit of red blood cells, but it's not as much. The plasma is really mostly clear, and just a little bit of the red blood cells get in there.
Okay, and this is the microneedling.
This is the microneedling.
It's little. Becky, is it hurting? No? Okay, don't move your mouth. Sorry, I'm asking you to talk.
No, it's fine.
It's fine. Getting it done.
So this is, I will kind of adjust the depth depending on how her skin reacts. I like to do one pass. This is about 1 millimeter. We can go up to 2 millimeters. But what I'm looking for is a little tiny bit of pinpoint bleeding, which tells me that I'm in the right layer of the skin. So I haven't gotten that yet, but I'm just seeing how her skin looks and how it's feeling. This is a very comfortable procedure. It's, as you can see, she's just chilling out, right, Becky?
How deep? Yeah. How many layers of skin are you going
So
down?
we're just going into the dermis, which is kind of where all the stuff is happening in your skin. We'll go a little deeper on this one.
So will this do discoloration if you have any sunspots?
It can help with it. I mean, I would certainly use it in combination with other things like IPL lasers or chemical peels, skin lightening creams, things like that. But it definitely can help hyperpigmentation.
What about acne scarring?
Yes, it's great for scarring. Again, you want to do a series of treatments with most of these kind of things. Usually at least 3 or 4 treatments. But acne scarring, fine lines, skin texture, tone, color, all those things. Are you still doing okay, Becky?
Mm-hmm. Becky, I don't think you have fine lines. I think they're being erased right now. It's like a big eraser.
So see how we're getting a little bit of bleeding, which is what I want.
Oh yeah, like you see those little tiny,
little kind of pinpoint
bleeding.
And I'll just go over at this step for a little bit longer. I'll probably go a little bit deeper in a minute, but I want her to be red, pink when she leaves, but not, otherwise she'll look normal.
Okay, so pink when you leave, and you go home and wash it off and put makeup on? Or is this...
I'll have her leave the PRP on alone for probably a couple of hours so it can soak in really good. And then before bed, she can wash it off. Starting tomorrow, she'll just use a gentle moisturizer. And then that's it.
So lots of different skin types in this room. Like you're fair anywhere.
What's great about this is you don't have to, whether you have dark skin, light skin, whether you burn easy, or if you have really dark skin, you want to be careful, even more careful about getting in the sun afterwards because you can get hyperpigmentation, kind of laser treatments and skin rejuvenation treatments. You see a little bit of
redness.
Yeah, that's exactly what we're wanting
right there, and you want that.
So I go over every area at least 3 times, so I make sure we're doing a really good treatment.
Well, I think if we're here, let's stimulate that collagen.
Yeah. Are you still doing okay, Becky? Still comfortable?
Yeah. Becky, like I clench my hands when I'm not good, and I feel like yours aren't clenched. You look comfy still. Are you?
It is. It's not. It tickles my nose more, the vibration.
Yes.
Like I want to,
Because it makes you want to sneeze.
yeah. It's
But you go right under the eyes too.
I do. I'll go
Around the eye.
I don't go on her eyelid, but I can go up, even up here and around her little lines
Well,
there.
and that's my
the eyes.
around the eyes. That's where you get those little fine
Fine lines.
lines.
Yeah, I'll turn the depth down a little bit around there because the skin is so thin, but we will go around her eyes. Probably at the end.
So I think you hear vampire facial and you see it on the Kardashians and you think it's a fad. No, this is like a real skin procedure that can actually make a big difference when it comes to aging.
Yeah, and PRP has been around and has been used for at least 30 years. Super safe. It's effective for all different things, but including the skin. It's becoming more and more popular.
Becky, I feel like it's going to be good. Do you recommend this for everyone, or if people came in, you might say, let's try this instead, or, I mean, this is good for some people and not for others?
I mean, it really is good for everyone, but certainly there are other things that are options as well. Like there's great chemical peels and things like that people maybe who are not wanting to go with more of a procedure. But this is a really easy, minimal downtime procedure that gives you very natural results because it's just your own skin making itself a little bit healthier.
No, which I do. I love. It's helping your own skin rather than having an unnatural look and an unnatural result.
Right. Yeah, there's nothing unnatural about this procedure. There's no possibility of side effects like allergic reactions or things like that you might get with some medication.
Okay, I have one more question for you. Should we do this in the summer and not get in the sun?
So
Is now a good time?
I do tell people that they need to wear sunscreen afterwards, which I recommend anyway. But if you're doing it, whenever you're doing it, you want to wear sunscreen for several weeks following the procedure because, again, your skin is kind of like a fresh baby skin, and you got to treat it like baby skin. And you don't want to get it out there in the sun and get it burnt or dark.
Well, I feel like you would say don't get in the sun anyway. Like stop and don't get your face in the sun.
I do that anyway, but especially after procedures in your face.
Okay, Becky, I'm excited for you. It's looking really, really good. Everybody, that's your look at a vampire facial. If you've always wondered what it's like. I mean, the name almost makes you think it's super bizarre and exciting, and it's actually just like just a skin procedure.
It's not super exciting.
Well, I mean, I'm excited for you. It's going to be exciting. When your skin looks amazing. But it's nothing unusual. Like it's something like you said, microneedling's been around for a while.
And you can do microneedling certainly by itself without the PRP. It's just better with the PRP. But you can use vitamin C or hyaluronic acid or other things as well. And some patients I'll have them, they'll do this one, they'll do PRP with it the first time, and then they'll do some follow-up treatments with just with other things like vitamin C or growth factor serums or hyaluronic acid or things like that.
Becky, thank you so much for letting us in on your procedure. I'm going to walk around and show you because they're having an open house tonight. Jessie, what are you doing here?
I wanted to check this out.
Hi.
I saw Kim Kardashian's been doing the vampire
Yes.
facial. Did you talk about that already?
Well, I interviewed Kim earlier.
Kim was here,
Yeah.
and we were like, get
She was
away.
here.
Because
Becky's here. Kim's
I'm so
slide
jealous.
out. Becky's here. I
I'm
know.
so jealous. And look who I brought with me, Mish.
I know.
Who I brought.
This is the age you'll look right after the vampire facial.
This is Nicea after.
My almost 15-year-old daughter. That's how Becky's going to look right after. I know you just stopped by, and I love that you're in my area in Draper.
I'm in your
I
hood.
love that you're in my hood, and we had to be here for the BioRestoration open house.
It's beautiful in here. I haven't been here
The
before. Have you
office-
been to this
So,
office?
I have. Yeah, I've been to this office before. And you walk in, like you see it outside, and you go, oh, I wonder what it's going to look like inside. It's gorgeous here. It's totally pretty. My 12-year-old keeps calling, so if there's an interruption in the video, you can blame my redhead. So sorry.
Because she's jealous that she's not
She
here.
wants to be here, so should we walk around a
Or
little bit
maybe
and
she's
show everyone?
nervous that you're getting a vampire facial.
Well, you know what?
I mean, literally, they talked about it. I had to Google what a vampire facial was.
This around so you can see down the hall. Look how pretty the office is. Sorry, girls, if you didn't want to be on Facebook Live. Hi. Hi. Hi, everybody. Hi, Jill. Hi. Okay, so I'm going to come out to the front.
I can help you out.
Jess, come with me. My friend Barb. Oh my gosh. Mwah. Facebook Living Barb. Say hi to everyone out there on Facebook. So the open house goes until 8 o'clock tonight. So if you are anywhere near, even if you're not near, you have time to get to Draper. BioRestoration, it's right off 123rd. there's food, there are giveaways all night long. That's what's so cool.
Can we go see? There's this cool machine over here, and people are putting their face into it. What? Did you see that? Did you do that?
No, I didn't
I want
see
to
it.
put my face
Okay,
in the machine.
okay, come here. Come put your face.
I want to put my whole head into this machine.
What is it? What does it do?
I don't know. We're gonna find out.
Okay. Come over here. Is this the machine you're talking about?
This is the machine we're talking
Okay, I'm gonna
about.
everyone can see what it is. This is
Did
it.
one of you just have your faces in the machine?
You had your face
Not
now.
even your face, your whole head was in the machine, right? Yeah.
And what's it for?
Show them your picture.
Well,
Oh, you go. This is Facebook Live for us for good things you tell.
don't do
You go. Oh, come on. Oh,
But will you tell us what is this for?
So this is called a skin scope, and it's just a device that uses a form of black light. It's an LED black light, and it basically shows all of your accumulated sun damage
Oh
or
no.
photo damage. Yes.
Oh no. Now I'm afraid to get in here.
Don't be afraid, because it's important to know what to work on, like
Okay.
what's going to be coming out in the future, and that's what this does.
I so want to do
Awesome.
it.
Do it.
I do.
Do you have anything on right now?
I just makeup.
What kind of makeup?
Well, I have foundation, I have blush, I have concealer. Maybe I have too much makeup on.
Is it a mineral makeup? Does it have
No.
zinc or titanium? Then we might be able to
Then
see
we can do
something.
it?
Yeah, let's try it.
Okay,
if
Jess.
we can't see anything, we can.
Jess, I'm going to hand you this because I'm going to do it.
She's gonna do it?
Yes, I'm doing it.
Okay.
Come in over here.
Oh wait, this is how we're doing it. Here she comes. Wait, I think you come on this side.
Which side? This side.
It's confusing. There's so much fun going on. Wait, Nicea DeGaring, her face. This is good Facebook Living here, people. Only Nicea can pull this off.
Pull back just a little bit for me. Okay, so I have seen some sun damage even through your makeup that you have on here. So what I'm going to look for is brown, any sort of dark pigment, discoloration, freckling, all of that is indicative of sun damage. So if you look at your forehead right here, you can see just a little bit of discoloration. It's harder to see through the cheek area just because you've got makeup on, but I can see a little bit right through there on that side, on your right, yeah. If you have your phone, I can take a picture.
I have her phone.
I have my phone.
I have her phone. But we're gonna use Nat's phone to get a picture and you guys can see it.
And then we'll take a picture so we can see it from out here.
I'm excited to see this. I hope you guys are excited to see the sun damage on Nicea DeGaring's face. Get ready.
Great. Oh, see, me too. So I understand that. Okay, here we go. All right, turn to the side. Other side. There we go.
Nicea looks nervous. Her
Okay,
hands are a
now.
little nervous. Are you nervous, Niche?
Okay, so I was a lifeguard. I'm afraid of the sun damage.
I work in a tanning
So
salon.
look, Jess.
Can you pull that up?
Do you see my under my makeup?
what lies beneath?
What lies beneath? Wow. Look how blonde my hair is right there. That looks
That actually looks good.
And then you see up through here, so this is all that brown, that's the sun damage.
So the
right
darker
there.
areas are the sun damage.
And a little bit down through here.
This is my new favorite machine.
So what do I do now that I know that?
One of the biggest things you can do is an antioxidant. Have you guys ever tried an antioxidant?
I don't think
Like
I've
that
done
you
it. No.
eat, that you'd be eating or putting on your face?
Well, not what you're eating, so topical. See,
Oh.
do you have oily skin?
I'm like acai. I eat a ton of acai. That's an antioxidant. Blueberries? No? What you put on your skin. Oh my gosh.
Oh, this guy.
Nicea. It's a little scary. And
Oh
super
wow!
awesome.
Why are Happy
is
Halloween! We did the vampire facial, and now this. We're scaring everyone.
It is
But
so
no, this
cool.
will help. This will help those areas.
So it's kind of, I call it my little light and brighten and tighten in a bottle. So it has anti-aging benefits, you know, for the skin. But the biggest, the best thing with it is it prevents sun damage and it corrects sun damage.
Wait, what did you just get something and then ran away?
No, he doesn't want it. He doesn't want to be in the video. I'm
Oh,
so sorry.
so sorry.
We're gonna have to blur his face out later.
I don't think we got
It's a
you.
gorgeous
Don't worry. I think we got
face.
you.
You need to keep it in there.
Thank you so much.
Once a day.
Once a day.
In the morning.
In the morning.
After
Okay.
you've cleansed, that goes on the skin, brush your teeth afterward.
Okay.
It's amazing.
And it will
Base.
help my. This is what it looks like.
Wait, why do you brush your teeth after though?
You want to let it sit in the skin.
Oh, okay. I
So
was like,
give some time. So I just tell people brush their teeth and then go on to your next product.
And then makeup on top.
SkinCeuticals.
Makeup on top.
sunscreen with
will
the
see-
Lighten and tighten and brighten.
Yes.
Lighten, brighten, and tighten.
Which I definitely. definitely need. Thank you. Atmosphere skin aging. Oh my gosh.
Can I have a turn?
You're next in there.
I think mine's gonna be a giant black
No,
spot.
no.
I
'cause you could
worked at
see-
tanning
well,
salons.
and I worked as a lifeguard. Like both of us did. Sun. It's never too late. No, it's never too late. It's not too late to come here either. We would love to see you. We're all here till 8 o'clock. BioRestoration. We're in Draper. Stop by, like walk in and take a peek. If anything, stop by and sign up for so many prizes they're giving away tonight. I can't even tell you. My good friend Barb Smith, that used to be at the station with me, just signed up for like 8 things. So she
I'm
could
gonna
win.
sign up.
I know. We're signing up.
Where's
We're
the
winning.
Swiss?
If you need a little something, skin, hormones, whatever it is, come by and say hi to us. And now it's your turn to get in there.
I'm
And we're
excited.
safe. Bye, everybody.
Bye, guys.
Okay. Oh, here's your menus. Feel free to. Thank you.
I don't know how to turn it off.